Are you okay, Mr. Jones? I know this is scary.
We were able to provide each student a $9,000 stipend a year for this initial cohort. I have so many students who use that money to pay their rent, to pay their bills, to feed themselves, because they're on their own a lot of the time.
I feel like if I didn't join this program, I'm not sure what I would have done outside of it.
Sometimes we think that we're not meant to be in this field because we don't look like the majority of the nurses that are out there.
As an undocumented student, I'm not eligible for FAFSA, for federal aid, for grants, for many scholarships that are for U.S. citizens and stuff. So the care pathway is the whole reason why I'm here and will graduate my nursing degree.
I'm gonna feel for your legs, okay, to check anything for swelling.
Look how far you've come.
I'm Janie Ortiz. I'm the project coordinator at Loyola University for the Care Pathway program.
1, 2, 3.
The Care Pathway program is a program designed to recruit and retain underrepresented nursing students. The first year seminar teaches them how to be a student. I was a first generation student, and I know how hard it is when you are the one filling out the FAFSA, asking your parents to just give you the documents so you can fill out whatever it is you need and then having them sign because they simply don't know.
We have very intense mentoring by faculty, by peers, and by alumni.
Starting the program, bringing these students in, it was more of a how do we help you deal with the stressors that the pandemic is going to leave for you. And one of the best parts of our program is we use an intervention called Cope to Thrive that helps them build resiliency and coping skills.
It's really important that nurses match the population that they care for, and that's not the case now. We can take a look at the city of Chicago, and we have our Black and Latinx populations hovering around 30% each, and nurses in the state of Illinois for those two populations are 8 or 9%.
Studies have shown that people have better health outcomes when they are treated by people who look like them or who come from similar backgrounds. So when we originally wrote the grant, I believe they anticipated around 30 total. We are now at 64.
There have been many opportunities where we were able to attend conferences and do seminars. It all helped with fostering the development of what it's like to be a nurse.
Being able to now be in the field and be able to also be that advocate for patients who look like me as well.
Throughout clinical, there was numerous times where I was used as a translator. Being able to do that is very rewarding.
These are my first students that I've had in the program. We've grown a lot together. Seeing them and know just the wonderful things they're going to do when they graduate is really special.